urban polling and introduce to you the Urban Polling Diabetes Prevention and Management Program. For those of you just logging in, please type your questions as we go along, and we will have a question and answer period following the webinar. For today's agenda, we will start off with a very brief introduction, and then we'll get right into what is urban polling. I know that some of you may already have had the chance to try, or perhaps you've heard about urban polling. And for those of you that haven't, do not worry, we're going to cover all of the information you need to know. We're then going to move on to the Diabetes Prevention and Management course, which has been put together a little short of 2 years ago. We're going to discuss briefly the diabetes and exercise, sort of the science behind it, and why urban polling is such a successful program for those individuals who have diabetes or who are trying to prevent diabetes development. We are going to give you some examples about urban polling programs in practice, discussing different examples of communities that have already embraced the program. I will then finish off by telling you a little bit about the complete package for this course, and then we'll get right into the question and answer period. So as mentioned, my name is Agnes Coutinho, and I'm actually the Director of Health Communications for Urban Polling. And one of the things that has always interested me about diabetes itself, and my background is in endocrinology, is the fact that a large proportion of cases of diabetes, as well as its complications, as stated here by the World Health Organization, can actually be prevented by healthy lifestyle choices. And with me is Claudia Mariano, who's a registered nurse, and Claudia is going to say hello and introduce herself. Hello, Claudia. Claudia, are you able to hear us? Oh, just a moment, we might be having a little bit of a technical difficulty. Apologies for the delay. One moment, please.
Hi, can you hear me now?
Yes, we can.
Okay, thanks. Sorry about that. I was just on mute. My pleasure to be here and to share the lunch hour with you. As Agnes mentioned, my name is Claudia Mariano. I'm a nurse practitioner at the West Durham Family Health Team in Pickering. I'm also a certified diabetes educator. I'm happy to share my professional and personal experiences with urban polling. We do have an urban polling walking group for patients here at my family health team, and I also sort of personally just really enjoy using my urban polls just for physical activity and exercise.
That's excellent. Welcome, and thank you so much, Claudia. And I do apologize. I think that was my fault there that you were on mute, so I apologize for that. Okay, so now I'd like to just take a very brief moment to introduce Urban Polling Inc. and its mission, as it's critical for this program. First of all, what really attracted me to urban polling itself is the idea that they really help to promote and work to promote health through fitness and education. They are the only organization with 9 accredited certifications that have been recognized on the national level by different accrediting body, both in fitness and rehab instruction. And as well, I've really witnessed and been part of various programming through urban polling that has been developed to really help to support individuals as well as community health leaders to successfully not only establish very successful walking programs, urban polling programs, but also in maintaining them. So what is urban polling exactly? Simply put, it's also known as Nordic walking, and it really is a growing fitness and wellness trend. And actually what it's really targeting is both the aerobic and strength training. It's a combination of specialized poles with walking. So it's actually very simple because you're combining cross-country skiing and walking. But there's a lot of research with now well over 100 different research papers showing health benefits that are associated with this activity that are more significant than just simple walking programs without utilizing the poles. And actually the publications that are out there are highlighting not only physical benefits but also mental health benefits of walking with poles versus walking without them. Urban poling technique has been designed specifically to really help to target more muscles in the body. And this is one of the key reasons, I think, why this activity has become so popular and so successful. On the diagram on the left, you see that in blue, there are highlighted muscles which show the muscles that are activated when you're just walking. However, when you take poles into your hands and you're walking, you are now using many more muscle groups in your body. You're utilizing not only your lower part of the body, but now also the upper part of the body. So as you use most of the muscles in your body, you're going to end up using more calories throughout that activity. So there's an increase in caloric expenditure. In addition, as opposed to when you're just walking, when you're properly using the poles, you're really going to target the core muscles, so the abdominal, lower back muscles. And this, over time, is going to help to promote good posture, balance, and stability. Research has also shown, and especially with the activator poles, which we're going to introduce in a little bit, that walking with the poles really helps to reduce the impact of your hips and knees. And in fact, the poles are used for pre and post hip surgery, knee surgery, and we'll talk about more examples. Importantly, these poles have been co-developed by an occupational therapist with the idea of creating a very safe and ergonomic handle. So the urban poles help to maintain the wrist in a very neutral and wide position throughout the whole activity. And so I mentioned the activator pole. The fitness pole that you see on the left-hand side here, these poles have a boot tip at the bottom, and you see the handle where both at the top and the bottom there's that wide grip, and the hand is in a very neutral position. And the fitness pole technique requires that the poles are on a diagonal, held on a diagonal, and the individual is propelling themselves forward. With the activator poles, these have been developed with safety, comfort, effectiveness in mind to really help to provide the greatest source of injury and fall prevention. And these poles are really an excellent tool for seniors, for example, to improve their gait, balance, and posture, but also for individuals who perhaps are elderly, more frail, or also those individuals who may need extra support in terms of their balance. I just want to go back to that idea about the handle providing a safer alternative. There was a paper that was published in 2006 by a German researcher, Dr. Carsten Knobloch, and he showed that Nordic walking in general is a safe activity. However, the highest rate of injury occurs when somebody is to fall and then lands on the thumb, the hand with the poles attached, and because of the strap, and that leads to skier's thumb injury or the Nordic walking injury. Now we contacted Dr. Knobloch, and he actually assessed both the fitness poles as well as the activator poles from Urban Poling. And following his objective assessment of the poles, he released a statement that he felt that overall the poles had a good grip, offered more support and safety, and that the handle was very convenient, and that overall the chance to suffer the Nordic walking thumb was probably reduced with the urban poles. And then he mentioned that this would be especially beneficial for those with diabetes or the potential to have impairment of balance and proprioception. Because of the extra feature of safety added to the activator poles, and also the fitness poles also have the same handle, we feel that the urban poles really provide this link between ability versus disability. So those individuals who normally wouldn't be able to go for a walk are able to use the poles to be able to do this activity. And this becomes of great benefit for persons that are at risk of falling, for individuals who may have issues with balance or maybe more frail or fragile, and they may be suffering from chronic pain and so forth. So there's many different conditions where using the poles becomes of a great benefit. But let's really focus on the diabetes side of things. So I mentioned earlier the idea that when you're walking with the poles, you're actually utilizing more of your muscles. So you're utilizing now the upper body. And this has this really great potential to slow the onset of chronic disease progression and perhaps even stop it altogether. And that's what I'm going to discuss with you first. But I just want to introduce you to how this program and the idea for it came about. And it all started with the idea of the wellness continuum. Urban poling is absolutely a physical activity, but we found that with the programming, with the walking programs, people are engaged in social activities, so often groups or individuals will group together to walk together. You can walk and talk, and so there is this emotional component. We've had clients let us know that they meditate as they walk, so there's this spiritual component. Being outside is of great benefit. We know that there's more and more research coming out showing how performing physical activity outdoors is more beneficial than perhaps some of the activities indoors. There's a Canadian researcher that published a paper last year showing that a group of women performing the same physical activity outdoors to compare to the control group indoors, the outdoor group showed more improved benefits in terms of cardiovascular parameters. For example, blood pressure was lower in the women working out outside versus those doing the same thing indoors. So the wellness continuum is the idea that urban poling offers a physical activity, but also it helps to target the other areas of wellness. Now, when we think about diabetes specifically, we know overall diabetes, whether it's type 1, type 2, or gestational diabetes, it's all related to high blood glucose, and our goal is to help to regulate that, to bring the blood glucose down. And we know that with exercise, there's a direct glucose uptake, and this is an acute effect of exercise. So as someone is doing a physical activity, their muscle groups that are being used are taking more and more glucose from the blood to be able to perform that activity, to make energy from it. Over time, there's also a chronic, an adaptive response to exercise in that the body will start to become more insulin sensitive. And we know in diabetes there is some issue with insulin. With type 1 diabetes, there is no insulin, insufficient insulin. With type 2 diabetes, usually at first the insulin is not being recognized by the cells. The cells are not sensitive to the insulin, and there's that insulin resistance. So exercise helps to, there's lots of studies to show that physical activity helps to reduce the insulin insensitivity and helps to take up glucose. Over time, those that exercise are help to increase their healthy body composition, so lower fat mass and maintain healthy muscle mass. And that's really important when it comes to diabetes. In addition, research has shown that with the use of the poles, individuals report less complaint of leg pain. So intermittent claudication is lowered when people are using poles for walking versus walking without the poles. And this response of the body using glucose to exercise is really localized to the muscle groups you are using. So for example, if you visualize that I'm going to flex my bicep and I'm making a curl with my arm, I'm flexing my bicep over and over, the muscles in my bicep are taking up blood glucose and helping to lower the glucose in the blood, and that glucose is being used to create the energy in order for me to be able to continue to flex my arm. Now, this response is really localized to my arm. This is not going to affect anything else. So the whole idea is the more muscles that are working, the better. And that brings us back to the idea of the urban poles. When you're walking with the poles, you're using more muscles. So that benefit, that acute benefit of exercise where you are helping to, in that moment, lower blood glucose as you are performing the activity is enhanced the more muscles that you're using. And we know that this effect lasts for up to 96 hours. And so we know that if people are participating in regular urban pulling classes using most of the body's muscles, they are gaining this huge benefit in terms of lowering their blood glucose in that moment, but also helping to become more insulin sensitive in the whole body in the long term. So now we're going to have a look at the different programs that are available with urban pulling. Now this, I must say, was just a snapshot of the science behind urban pulling. We do go into more detail within the course. But I wanted to take a moment just to let you know how urban pulling started with the diabetes course. And this was something that was launched first in Aboriginal communities across Canada. About 2 years ago, the program was launched at the National Aboriginal Diabetes Association. And there, the program was really well embraced by different health leaders within communities, nurses, that diabetes educators, and the Aboriginal Diabetes Initiative workers. We've had tremendous response now after 2 years from various groups reporting huge benefits in terms of better blood glucose results, weight control, and just adhesion to programs. For example, Penny Williams, she is a health program coordinator at the Walpole Island. Now, I personally went to train Penny Williams, and we've been in contact, and she reports that just after 3 weeks of participating, individuals were already reporting better blood work. And so this has continued, and Penny leads a tremendous walking program that is ongoing. Beyond the Aboriginal community, urban pulling is expanding across various diabetes education centers, and we are doing training in person as well as online for various units. For example, currently the Sudbury District Health Unit has an urban pulling walking program, as does the West Toronto Diabetes Education Center and the East Toronto Community Health Center, and other centers such as the Hotel Dieu Hospital Diabetes Program in Kingston. And I should mention there, they've also combined it with a cardiac rehab center. So, and this is just an example of the different centers that have been using the program successfully. And now I'm going to hand over the mic to Claudia, and she's going to talk a little bit about her experience.
Oh, thanks so much, Agnes. So the urban pulling that I found sort of personally and professionally to be well suited just for so many reasons. It really is an activity for everyone, regardless of your age. So you can do it in groups, in families, children can do it, grandparents can do it with adjustments with the poles and using different poles, as Agnes mentioned, activator poles versus the fitness poles can be more beneficial for seniors. So it really is something that everyone can do across the lifespan. And as health educators, I know we often struggle with with patients about what physical activity can be recommended when we're encouraging them to be more physically active. And I just find the urban pulling is really easy for people to do, and then people are generally quite excited to do that. So you can easily adopt that in your centers. We started doing the program here. Actually, we started offering it for patients in January, in the middle of winter. We weren't sure if we would have people signing up, but our first group, we had 10 people, which is great because we only have 10 poles. So it was 10 sets of poles. So it really was very easy to do the training we were able to do online. There was a lot of good support in terms of training videos and showing people how to use the poles. So it was really, really great for our center. We do have a consent form that we have our participants sign before they start, and they're also given a handout which explains some of the benefits of urban pulling, and they're also given a link to some of the videos that Agnes is just going to review with you later on that people can find on their website just to help them get a bit of a heads up around what urban pulling is all about and some of the technique behind it. So it really is very easy to do and incorporate into your centers. And as I said, I started out just with my own poles. that I purchased about a year ago, and just so enjoyed using them. I thought, we really need to be recommending this and helping our patients, particularly those with diabetes or other chronic disease, just be more physically active, and this is a means for us to do that. So it's worked really well for us. So could I have the next slide, please, Agnes? And you can do the urban poling year-round. I know sometimes people are a little bit leery about being outside and walking, particularly in our Canadian winters. But as I said, we did start our program in January. May not have been the best time if you're going to be considering doing that in your own site. You might want to consider perhaps doing it in spring or summer, but I don't want you to be discouraged or feeling that you shouldn't be starting as the winter approaches. You really can use the poles on all surfaces. So whether you're outside on the road, on asphalt, you can use them on trails. So at one point we were doing hiking trails through one of our local hikes here. The poles are adapted. You take off the rubber boot tip, and there's a very hard pointed carbon tip on the bottom, which is great to use when you're on an uneven surface or a surface that might actually shift, so on sand or gravel or trails. So you really can use it on any surface. I really enjoyed this past winter using my poles, going through the local park in the snow. It seemed like an even better workout with the resistance of the snow. So you absolutely can be using it all year round on any surface. So it's very, very adaptable. Could I have the next slide, please? As Agnes mentioned, there seems to be really very good evidence around how people adhere to a program of urban poling. As health professionals, we know that we often see patients who have started a particular exercise program, or we are recommending to our patients, particularly with diabetes, that they need to be more physically active. And people will often have great intentions and are very excited about starting up a particular program of exercise or a regimen, and then after a while it dies off and they stop. They buy the treadmill, which they use a few times, and then it ends up holding all the laundry that needs to be dried or something. Or they buy a gym membership and then they just really don't go. So one of the things I really appreciated was that there's actually research that supports that people are more likely to continue the physical activity of urban pole walking versus even a traditional walking program. So if you were to do a regular walking group or just walking on your own, we actually know that if you're recommending urban pole walking to people, to our patients, they're actually more likely to continue with it than if you were recommending any other form of physical activity, including just traditional walking. And I think that speaks to all of the other benefits that Agnes mentioned earlier in terms of social, spiritual, intellectual. It really is a great program. I always say it's, urban poling works all of the muscles from the neck down, but it also uses your most important muscle, the brain, because since you are outside, I do find there really is an improvement just in both in mood and in energy, because you are doing it outside. And I have one of our very first people who joined our urban poling group. She actually hadn't registered for the group, but happened to be in the waiting room after an appointment with our social worker. She had chronic severe anxiety, and as she saw us in the waiting room getting our poles together and getting ready to go out, she asked if she could join us, and we did have room at that time, so she came. Her anxiety was severe enough that you could physically always see her shaking. She physically always had like almost a whole body tremor because her anxiety just had her shaking so badly. So she came with us on the group. She was nervous, but she came with us. And even at the end of the very first session, by the time we got back from our walk, she had a big smile on her face. She was no longer shaking. She was so impressed and happy with herself that she had been able to do it and to be in this group of people and feel comfortable. And she came back regularly after that. She was always one of the first people there. Her anxiety decreased significantly, and she became friends with one of the other women in the group. It was really, really nice to see that. It was a very, very dramatic change, and really all she was doing was doing urban poling, so it was wonderful. So it's, to me, that's just such a great example of the improvements you can get in not only physical health, but also emotional and mental health with urban poling. Can I have the next slide, please, Agnes? So Agnes mentioned the different poles. So there are options available for patients depending on their physical and mobility issues. So the fitness poles, the ones that have the little boot tip on the bottom that Agnes mentioned, those are best for people who don't have any particular issues with balance. They don't have any, knee or hip arthritis, or, they're not post-knee or hip or other joint replacement. They don't have any other sort of chronic condition that makes them more reliant on other mobility devices. Generally, people who are, who may need to be using a walker or 2 canes probably shouldn't be using the fitness poles. The activator poles, which you can see on the bottom of this slide, are more suited to people who may have balance issues, who may have some perhaps neuropathy, diabetic neuropathy in the feet, and they're also really great for people, as I said, post hip knee replacement. So we have had people who also after their physiotherapy sessions have been completed for their knee or hip replacement, have joined our urban poling program using the activator poles, which give them more balance and more stability, and it encourages them to continue to be active and walk after their knee replacements or hip replacements. So it really does work very well for those people. So it really, there's hardly anyone who couldn't use the activator poles. The only patients you might see who would not be appropriate perhaps are people who are walking with perhaps 2 canes or actually a walker. They likely have balance issues and progression of disease enough that they wouldn't be good candidates for the urban poling. But really anyone else, it's very, very well suited for. Could I have the next slide, please? So why is it urban poling just become so popular for everyone, but particularly for people with diabetes? As Agnes showed, the great uptake among the Aboriginal community, whom we all know have very high rates of diabetes. So, I mean, it is fun, first and foremost. I mean, there's no point recommending any kind of a physical activity to patients, whether they have diabetes or not. If it's not something people are going to enjoy, they're not going to stick with it. And it really is fun. I've always been a big walker, so when I saw the poles, I thought this might just be a great way to amp it up a bit. And I have to say the difference is amazing. It is not the same as simply going for a walk outside. With using the poles, you really do get a different kind of workout, and it feels wonderful. It's quite a bit of fun. As Agnes mentioned, because you are using so many more muscle groups, you do have higher calorie expenditures. So people seem to be really happy that even if it's not intentional, they seem to be losing weight. And more importantly, they are losing fat mass, but maintaining or even increasing muscle mass. Using the poles really helps activate those back and shoulder, chest muscles, arm muscles, and people do really start to notice a change in muscle development. So it makes people really more likely to stick with the program. The decrease in waist circumference is a particularly important measure, particularly for those with diabetes. We know body mass index isn't necessarily associated with improvements in morbidity or mortality, but certainly waist circumference we know is a much more sensitive measure. And I'm sure being in diabetes education, most of you on the line are doing waist circumference as part of your objective measures for people with diabetes. So waist circumference tends to decrease as well for people when they start doing urban poling. Many of our people with diabetes have comorbid conditions such as high cholesterol, high triglycerides, and those improve as well with the increased physical activity, as well as the decreased claudication pain that Agnes mentioned as well. And people who have claudication, I mean, they're a very challenging group to encourage to be active because it hurts when they walk. And whether it's because they take some of the pressure off their feet and their joints using the urban poles, who knows exactly why they seem to have less pain, but they do, and so they're more likely to stick with that exercise. And because of the social interaction of people wish to be walking in groups, but also because you are outdoors, I think it's a much different workout. People do improve in terms of their mental and emotional health. They enjoy seeing that they can walk farther, walk faster, and that they just feel so much better overall. And so it's to me, it's not surprising that people are more likely to continue with a program of walking if they're using urban poles versus traditional walking. So the next slide, please, Agnes.
So this is one, thank you so much, Claudia. This is one that explains a little bit more why urban poling may be a great choice as well. This is an addition to that. More and more insurance companies are covering the activator poles for aid to mobility. For example, the Great West Life does 100% of the time with the proper official receipt and prescription from a healthcare provider. Other insurances, such as in BC, do cover the poles for rehab clients. And for all Canadian veterans, regardless of age, the poles are covered 100% of the time under the POC 1 Aids to Daily Living. There are other insurance companies that do cover the poles, but this is really case-by-case basis. And what's really needed in order for that to happen is a prescription, again, from a healthcare professional and an official receipt. And that can be made available through the major retailers where poles can be purchased. So whether it's Shoppers Home Healthcare or Motion Specialty stores or other independent pharmacies that carry the urban poles, that official receipt goes a long way in getting the poles covered. And in addition, Urban Polling has put together justification letters that are available to support the prescription. And we can certainly mail that out to, or email that out to everybody following the webinar. So thanks again, Claudia, for that great description of the various programs and your own personal experience and experience with your own patients. There are many programs that we don't have the time to give examples for, but just to give you a little bit of an idea about the program itself, again, it's based on the wellness continuum, and because it has all these aspects, we have partners who have come together to really help to create this wellness continuum-based package, both for community leaders, but we also have a separate package for general public. And there's lots of extra tools that have been provided to really help either prevent or manage diabetes altogether. This is just an example of the agenda that's available online with various links to resources and information for those that go through the course. So with the course, individuals get a set of polls, 2 cookbooks by Karen Graham, who's a registered dietitian, and there's lots of other information in terms of keeping track of progress, helping to start a program and maintain a successful urban polling program. There's lots of information about the technique, right from setting up your polls to various steps on how to help improve technique, and also various sets of exercises that are available with the polls. Because often people think of urban polling as just a walking program. However, there are other exercises that can be performed, really helping to highlight that it's a strength training and an aerobic activity. So there is lots of information in terms of tips on how to make sure that you and your participants in your group are performing the technique correctly. There's actually over 20 videos that are available online which show different tips on technique. And also there is a manual that comes with the program where we list various warm-up exercises, strength training exercises, and cool-down stretches. And this is just an example of some of the warm-up activities. And these come as images that you can see, and also a short description, a verbal description. And then there's also the video to supplement that. So for each walk, you can incorporate some of the activities based on your participants' ability and the progress in the group. And one of the key things, I think, that really helps to motivate me to keep working with Urban Polling to promote this activity to others is the feedback from clients and various patients that really shows that this program is working for individuals all over Canada. And I know this even personally because on the left side here is actually a picture of me and my family. So on the left-hand side are my parents, my husband, and my daughter, and every year we do a 5-kilometer Toronto Challenge walk. And this would be really difficult, and in fact for my parents impossible to do without the poles. My dad is a stroke survivor, and my mom actually has type 2 diabetes, and she is also a stage 4 kidney patient. And so for the two of them, a 5-kilometer walk without stopping is nothing short of a miracle. Prior to the poles, this would not have been possible. And so I do have this personal drive to seeing the transformation in my own parents, and then in different individuals that I've been working with in different communities, and then hearing stories such as Claudia mentioned. It's just really empowering for urban polling to continue to grow based on the feedback that we get from the clients. The next two slides, I don't expect anybody to read all of the columns, all of the points, but essentially they are done to sort of outline the different benefits of active living with urban polling. We know that the general benefits are that urban polling helps to work more muscles and promotes healthy weight and glucose control and improvement in cardiovascular health. And today we've been talking about diabetes, but I think just as the patients and clients that you may have, they don't necessarily only have diabetes. They may have heart problems, they may be aging, some may be trying to manage their weight or have other complications such as MS or Parkinson's. The beauty about urban polling programming is that using the polls really helps to manage all of those conditions, not just the diabetes. And I'm happy to send a PDF of this slide as well as the next one that I'm just switching into right now. If anybody would like a copy, I'm happy to share that. And all of the points here describe the benefits within these conditions, and all of these are from research. So it's not only things that we hear from clients, but also research-based information. For example, there's great papers showing benefits for cancer rehab patients in terms of their rehabilitation post-surgery, those with arthritis. We mentioned with mental health, there are many papers that look at various conditions, and one of the common denominators in each of these research papers is the fact that there's this improved quality of life, reported decrease in anxiety, depression, improved self-esteem, and for any of the conditions that we've touched on today, and especially with diabetes, we know that over 30% of patients with diabetes have depression. All of these things are improved and show significant improvement with programs like urban polling. Recently, Urban Polling has put together 4 new modules that are specific extra details around helping to set up a program and using specific tools. So for those that are working with pre or post natal women, elders or seniors, mental health, and youth. There's been a lot of interest in the youth groups, and so we have put together modules that help with the setup and maintenance of specific walking groups for those individuals. And at this point, I want to thank you so much for your attention. Thank you, Claudia, very much for that wonderful description of your experience with Urban Polling program. It's very motivating and great to hear. And at this point, if anybody has any questions, I will address them. So if you are able to type them into the window, I will be able to address them. So I'll just take a moment to let you do that. And once again, thank you very much for your attention. And if anybody has any questions after the webinar, please feel free to email me at agnes@urbanpolling.com. And if you would like a copy of the 2-page information sheet about the different conditions, I will be happy to send those. So I'm just going to take a moment to see if there are any questions. And I don't know if you would like to say anything else, Claudia?
I mean, I can just share. We've had people come to our walking group with their own poles. Some people have them already. Most people I find have never really used them or only used them a couple of times. People often ask about the specific poles that we have, and which we did get from urbanpolling.com. They're actually the Aboriginal spirit poles that you saw in the previous slide with the Aboriginal community. So they're really nicely painted and decorated as well. But so you can buy urban poles, you know, at many retailers now. I do see people in my local community. You know, when I'm out for a walk, I see people with their own poles. But I do just have to state that the specific poles that we have through urban polling, as Agnes was mentioning with the handle, The handle is really very specific to these particular fitness poles, and I do find it makes a really big difference. When we've had people come with their own poles, many of them have a handle that perhaps looks more like the one you might see on a cross-country ski or a regular ski pole, or they have the strap on them. And they don't actually, I find, give people the stability or the workout that you might get with the Urban poles, because the handle is very different. And when people then try the poles that we have here, just to see the difference, they very, very often, in fact, every single time, they have preferred the use of the poles that we have with that specific ergonomic handle and the lip on it. So it really does make a difference. I've had people say, oh, I found these poles, much cheaper at, Sports Check or wherever, some local fitness store or athletic store. And when they actually use them and then compare them to the poles we have, there really does seem to be a difference. So not all poles are created the same. So I did just want to put in a little plug for that. The handle really does make a difference.
Thank you, Claudia. I absolutely agree. I also get a lot of comments about different poles and questions from individuals. And I always tell people that ultimately it is the choice of the individual. Of course, there will be other brands, as there are with cars and toothpaste and soap. But I think everybody has to choose what the right type of pole is for them. And in terms of individuals who are, especially those that have issues with balance, older, more frail individuals, it's really important that safety is the first #1 concern in terms of ensuring that the poles are ergonomic and they are strapless, so that if the individual was to fall, you can just imagine if you are holding poles with a strap and if somebody does trip and fall, they are not going to have the time to take the hand out, the wrist out from the strap. So if they are going to fall, the last thing you want is for those individuals to be attached to the pole. But absolutely, most individuals in the classes that I've attended and the groups I've attended that have brought their poles end up using the Urban poles. I think there is one question about watching this seminar again, seeing the seminar again. I just want to say that the webinar has been recorded, and we can definitely make it available for others if you wish to see it again or show it with others. Thank you for that question. So at this time, if thank you. And if there are any other questions, again, please feel free to email myself at Agnes at urbanpoling.com. And if you have any questions for Claudia, I'm very happy to pass them on to Claudia, if that's okay with you.
Absolutely. Yeah, I'm happy to answer any questions people may have.
That's excellent. Thank you so much, everybody, and I hope that you will give Urban Poling a try, and if you'd like any more information, let us know. Thank you so much.
Thanks, everyone.